My guest on this episode is an award-winning public health leader, native Floridian, and is dedicated to health equity in Black communities. And she joins us to discuss her journey. You're listening to the PHEC podcast, episode 347. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. You may not be aware of this, but I lead a public health and epidemiology consulting firm with a strong data team that supports large nonprofit organizations, as well as government agencies that serve Black, Indigenous, and people of color communities, often referred to as BIPOC communities. We are often invited to support tribal organizations and are always honored to serve. We help our clients communicate their data and health information in plain language to the communities they serve. Now, this type of support builds and strengthens relationships between organizations and the individual community members. Some examples of the support that we provide include comprehensive toolkits, fact sheets, custom reports, community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific diseases and health-related topics that are most pressing within that community. Now, if your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, which is drchuntley.com. And we'd be happy to meet with you and explore how we might be able to help support your organization. Links will be provided in the show notes. Now, in this episode, my guest is Rebecca Desir. I've had the honor of coaching and supporting her through one of our online and in-person events for public health entrepreneurs. It has been rewarding to watch her lead and grow her organization, and most importantly, have a great positive impact on her community in Florida. She is an inspiration, and I'm excited to have her as a guest on this episode of the podcast. Rebecca Desir is an award-winning public health practitioner from Fort Lauderdale, Florida, and is currently the Senior Manager of Community Advocacy at AdventHealth in Central Florida. She's dedicated to health equity in Black communities and founded the nonprofit organization called Black Health Commission and organizes the annual Black Joy Festival. Rebecca has received recognition such as Orlando Business Journal's 40 Under 40 and was a finalist for Orlando's Sentinel's 2023 Central Floridian of the Year. Active in her community, she serves on the boards of the LGBTQ+ Center Orlando and the Center for Thriving Communities. In her free time, she enjoys reading, attending music events, and hosting game nights. Let's connect my conversation with Rebecca right now. Hi, Rebecca. Welcome to the podcast. How are you?
I'm good. How you doing, Dr. Huntley?
I am good. I'm super excited to have you on the podcast. I'm not sure why it's taken so long. I intended to have you on the podcast a long time ago, but we're just not getting here.
This is perfect timing, honestly. It happened when it was supposed to. There's a lot more for us to talk about this time around.
That is great. That is great. Well, let's dive in. Let's start with, some folks may not be familiar with who you are. So let's just start with you telling everyone a little bit about yourself.
Yeah, so I'm a native Floridian. I know that comes far in between nowadays, but I still live in Florida. I work at a local regional hospital system here in Orlando, but I'm also the founder and executive director of Black Health Commission.
Yes, nice. Now we're going to dive into that, all of that. There's a lot to unpack in that little bit even. I'm super excited because I know you. I remember when we first had our very first in-person retreat with the Expo, the Public Health Consulting and Entrepreneurship Expo. And this was in the beginning of 2023. And we were in Orlando. That was our first in-person. And you came, and I love the whole group that was there, but I really got to know you and challenged you a little bit.
Yes, you did. Yes, you did.
But it's wonderful. So we're going to dive into all of the things, all the hats you wear. But one of my favorite parts of this kind of conversation is kind of going back and kind of seeing the journey. So how you got to where you are now. So when did you first learn about public health?
Oh my goodness. I learned about public health. It was actually my senior year in undergraduate. I really didn't know what I wanted to do because I was pre-nursing and I didn't get into nursing school. And so I chose the major that took most of my credits, which was exercise science. And through that journey, I learned more about, just research. I had a professor that really grounded me and kind of took me under his wings and introduced me to public health. He was like, you have a natural knack of curiosity and research, and you would do really well in this field. Have you heard of it? And I'm like, no, I've never heard of public health. Like, what do you do there? Like, what is this about? And so he encouraged me to look into different programs. And so 2 weeks after I graduated from FAU with my undergrad degree, I was at FIU for my master's in public health. And it was a very short turnaround. I just knew that, okay, this makes sense. I like that it's, multidisciplinary degree, and it made me interested in learning more. And that's what made me sign up. No real career path in mind. I was like, okay, this sounds good.
That's good though. I mean, I can relate to that. There was a point, some people asked me, well, you have a liberal arts undergrad, your bachelor's. And I was like, well, that was the quickest route to completing that piece of paper because I needed it for another purpose. So it was not about the fluff. It was the shortest route to the finish. So I definitely understand. Now, is there a particular problem or population that you're really passionate about?
Yes. So being the daughter of two Haitian immigrants, I had to be kind of like that third parent of just navigating the system, translating for my mom when we're going to school or even at the doctor's office. And I noticed how difficult it was, not just being Black, but being a migrant to the United States and just trying to figure out, how do you navigate this tricky system? And I knew that if it was tricky for them, I wondered how others were feeling navigating it. I really kind of honed into that mind frame when I was at FIU getting my graduate degree and really started learning that, okay, I really want to focus on minority populations, but my heart is really Black diaspora, like not just the Black community. I think a lot of times people try to create initiatives and say, oh, these are for Black folks. And it's like, Black folks are not a monolith. We are so different. And there's different ways that different, subgroups in the Black population navigate healthcare. So that was really my thing. And then it was also a time where social media was gaining popularity and, organizations and companies were trying to figure out, how do we use this platform to share our knowledge? And I remember one of my professors, Dr. Howard, shout out to you. She was like, you know what? You need to figure out how you're going to tie social media with public health, because you have a point. Like, I think this is going to get much bigger and people are going to be using it to share information. But yeah, you should really look into how to tie all of those things together. So that was the spark that kind of helped me get where I'm at now.
I love that. Creativity. That makes it exciting to me. And it's a little bit of a disruption in the regular flow of things, right?
It is. It is. I like to call myself a disruptor.
Yeah. Someone called me that and I was offended at first because I thought that it's like a negative thing. But no, that's like, I'm proud to be referred to as a disruptor. I think that we need more of that in public health, right?
Mm-hmm.
Well, I think that I know I'm going to get ahead of myself because I know that we're going to dive into that part a little bit more. So my next question is, well, let's kind of explain what you do now. I think that kind of talking about, the sort of your past and how you first found out about public health, we understand your heart. And I'm remembering some really fun moments when we were in Orlando in the room. Even in 2023, we had a little bit of a deeper discussion of the diaspora, because you think about it, in that room we had Black folks in the room, but we had Jamaica, Haitians, we had British, we had a very diverse blend of folks in the room. And then this past experience for 2024, again, a very rich mixture. And we got into a deep conversation. I was telling you a few minutes before we started recording. We had Haitian, Jamaican, Nigerian, and we're all talking about, someone mentioned, how we always talk about food, right? But someone mentioned rum cake, and the woman who was Haitian said something about, oh, how do you make that? You just throw these things, you put the nuts in and the two ladies from Jamaica were just so taken aback. They were like, whoa, that is not, we soak the ingredients in a special type of rum overnight. And there was just like this. So the cultural differences, that really started to surface. We are so different.
We are.
And so I appreciate your comment about we can't just treat every Black person the same. And I can certainly appreciate those differences and nuances. So I just really liked you highlighting that. Let's talk a little bit about what you do now.
Okay, so now I feel like I wear so many different hats, Dr. Huntley. So my full-time job, I'm one of the senior managers in our community advocacy department. So I spearhead our community health needs assessment. These are all language that we've learned in grad school, and now I'm actually doing it in real time, which is pretty great to have the opportunity to do that from a healthcare perspective and being able to tie in the knowledge that I've learned working at the hospital and background in public health to tie all of that and see how we can better address those top health priorities in our community. So we collaborate with lots of different departments within the hospital system. But at the same time, I'm also running Black Health Commission. I'm so blessed to have an amazing board and team, folks that just kind of saw me doing it by myself in the very beginning. And over time, people have joined either being a board member or an advisory board member or on the actual team, helping with the day-to-day. So we have a really good, solid group of folks, and we're actually looking for more board members to help grow and keep up with the needs of the community. But along with that, I sit on the board for the LGBT Center here in Orlando, as well as the Center for Thriving Communities. That's a statewide organization addressing health disparities. So keeping myself very busy along with my cat. It's being an auntie, being a daughter, being a sister. So just trying to keep up with everything. But my passion keeps me grounded and connected with all of the things. So even though it seems like a lot, but they're all intertwined.
Yeah, definitely understand. I can relate to, yes, you're wearing many hats. I love what you do and how you do it. I know that, sometimes like when we were in Orlando, I had my coaching hat on and I was, really leaning in, but that's because I really connected with your drive and your positioning and the amount of impact that you're able to have and the potential for future. And I love that you really leaned into that, over this last year, even since we worked together in Orlando. I've seen so much growth. Tell us a little bit more about the Black Health Commission. It's for people that maybe have heard about it or seen you in social media, but not quite sure what it's all about.
Yes, so Black Health Commission is a local organization based here in the Metro Orlando area. We really focus on educating folks on the health inequities in the Black diaspora and connecting folks with the resources. So oftentimes, we hear of all these different statistics where Black folks tend to get the short end of the stick, and just trying to navigate a system that wasn't really built with us in mind. And so what we try to focus on is assets. What are the assets in our community? What are the things that we used to do as a community to build resilience? So we do that with our monthly village talks, where we bring the community together and we bring a subject matter expert to discuss different issues that impact the Black diaspora. And then what we're known for, and I feel like we've gotten a lot of recognition for, is the annual Black Joy Festival. So every summer we host a Black Joy Festival, and that's where we do collaborate with the other organizations in the area and identify small Black businesses to be able to share their merchandise or services at the place. But we like to focus on the fun. It's also a cookout. We like to say, we have the DJ, we have the space table going, we have food vendors. So it's a really great time, but again, centering joy, centering mental wellness.
Yes, I love that. I just have to do this since it's at the time of this recording, this is very fresh, just happened to you. You had the surprise award at the event that you attended. Can you tell us a little bit about that?
Yes. So this past Saturday, I went to the African American Chamber of Commerce. They host a annual gala and Eagle Awards. So I went, in support of other organizations, other companies in the area, just doing amazing work. And the president, Tanisha Gary, she came on stage and she was saying, they really want to do something different. They're going to announce grants for local nonprofits. And so I'm like, oh, that's so nice. And I'm playing a game with my friends at the table. We're like, let's guess and see, what organizations are going to be called. So they're naming them. And I'm like, oh, that's Hebony. Oh, that's Route 7. And then the last organization to be named, as they're calling out the bio and the mission and all of that, I'm like, that sounds like Black Health Commission. Like, that sounds like me. And so I'm slowly digesting what's happening. And then they finally call out Black Health Commission. And I screamed, and the entire table screams because we're just so surprised. And so it was great to be able to kind of share that moment with other organizations that we've collaborated with over the years. And so it wasn't like we're just on the stage with folks that we didn't know. It really was a testament to how we've been able to collaborate with other organizations and just the work that we've been doing for the past 3 to 4 years now.
Oh, I love that. I'm excited for you. And like I said, at the time of this recording, someone may be watching this a year from now and maybe you just want something even bigger and something so different, but
it's really surprising. It's surprising when you kind of step out on faith and didn't really know where the resources were going to come. I just was like, okay, God, like, I know this is what we need. I see it in my day to day, talking to different folks, talking to different community members. And so it's just keeping faith and connecting with others and making it happen.
Yeah. Oh, such an inspirational story. You are an inspiration. I am so excited for you and really can't wait to see what comes next, because I know it'll just be more great things and the way you're serving the community and getting involved and connecting with the community. It's just really such an example to follow.
Thank you. I appreciate it. Our team is amazing.
Yes. So as we begin to kind of wrap up, because I know you've shared a lot and I appreciate all of it, I just have a couple of more questions. I'm going to shift a little bit into connecting the dots. I think it's nice for people to really, in the conversation, I like to ask this question because it helps people kind of come full circle with things. Some people listen to this podcast don't have a public health background. They're listening because they want to understand it better. So my question for you is, how does the understanding of public health help you better serve the communities? Now, this could be applied to the work that you do in your full-time job, or it could be applied to the work that you do with Black Health Commission. But just how does the understanding of public health help you serve and have a greater impact?
Yeah, so oftentimes one thing that is part of our spiel when we talk about the Black Health Commission is oftentimes people reach out to us and asking for diabetes screenings or, just the very common way of thinking about healthcare, where it's more about access to a primary care provider. And yes, we do promote those services and those resources in the community, but where we really shine is through the social determinants of health, because 80% of your health is determined by those factors, including your education level, your economic stability in the world, all of these different things. And you have to be able to address and be able to get connected to those services or resources in order to fully have a great sense of well-being and not just, getting people insurance. Like, yes, that's great. That's a great step towards it. But then what's happening outside of the doctor's office, outside of the hospital walls, and helping folks get connected? Because oftentimes there's so many great organizations that's doing the work, but then they don't know that those resources are out there. So just with the knowledge of public health and knowing that health is everything, that helps me address this type of work, knowing that, okay, we can help you here, but we know that you need those wraparound services in order to really address your overall well-being.
Yeah, that's great. Oh, this has been so good. I guess my last question for you, and I will make sure that everyone who's listening and interested in connect with you through our show notes, and I'll tell them all about that in a moment. But we have a diverse audience of listeners, like I mentioned. So if someone's listening now and interested in some of the same types of things that you do you have any bit of advice or tip that you would share with anyone who is, maybe trying to find their way in public health and they have some passions and interests and they're listening to you and going, oh, that sounds like maybe I could do something like that. What advice would you have for someone?
I would say keep an open mind. When I first got into public health, it was really out of the encouragement of one of my professors, and I really didn't know what it was. But I kept an open mind, any opportunity to get out into the community. I interned with an organization that was providing HIV and AIDS services in Miami. I worked with a research institute in Miami. Like, I really dabbled into so many different things because I was like, I need to figure out what route I'm taking, but I'm one of those folks that need to be immersed in that to be able to figure out, do I really want to do this or do I not? And so I just really put myself out there, and whatever opportunities that came about, I took it. And when I graduated from grad school, I thought I wanted to work at CDC and I applied. I didn't get it. And I'm sure that's the natural route that most people think, like, okay, public health, let me try to get a job at CDC, but not understanding that there's just so many other routes to take in public health. And so I took this position as a health promotions manager at American Lung Association. That was my first introduction to not only nonprofit and fundraising, but also how these support groups and all of these other factors can help folks that are living with lung disease. And I was like, oh my gosh, this is still public health, but it's not the way that I thought that it was public health. And it's crazy because although I never wanted to fundraise, now I'm fundraising for my own public health organization. And I think those skills that I learned from that time with American Lung Association has helped me be a better leader in the nonprofit space, but also in the work that we do at the hospital. We work with other nonprofit organizations. So now I have the other side of, like, I know how it feels to reach out and ask for money, and and being able to be on the other side of reviewing the applications and assisting with that process. That has given me a better insight and being able to share that with my colleagues too. So you just never know. But if I didn't take that opportunity to work at that nonprofit because it didn't align with what I thought public health was, I feel like that would have been a disservice to my future self, because now I'm able to hone in on all those skills that I acquired and be able to help me in my current phase now. So
yeah, that's great. I love that tip. That's solid guidance. I mean, because we never know, right? I love that example that you shared personally to kind of support that. So thank you so much. It has been wonderful to catch up with you and to hear you share about your journey and what you're doing, and keep up the great work. I love cheering you on from the LinkedIn background.
Same here. Like, I'm always excited to see the new episodes, and just your team is growing. So I'm over here cheering you on too, Dr. Huntley.
Oh, thank you, Rebecca. I love it. I love it. I feel your support.
Yes.
Well, I will let everyone know how to connect with you shortly, but I just want to thank you for being here, and I appreciate you.
Awesome. I appreciate you too. Thank you for the opportunity.
I really hope you enjoyed that conversation as much as we did. Rebecca is truly a powerful and heart-centered community leader, and I encourage you to connect with her and support the work that she's doing. You can find the links to connect with her on the show notes page. On the show notes page for this episode, which is 347, can be found at phecpodcast.com. Once you're there, navigate to episode 347 to find the show notes. Now, one more thing before we go, please take a moment and share this episode with a friend. I'm sure you know a few people who would be interested in hearing this conversation. Now, if you're listening right now in one of the podcast apps, you can easily share this episode through a text or directly to social media. At the bottom of the show notes page, you'll find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.